Hello everyone, I am Zach, and my partner is Brian. Today we are going to talk about fecal microbiota transplant. And here are 5 essential groups: fecal, endoscopy, infection, side effects, and diarrhea. First part, we will introduce some simple concepts, and second part, we will introduce some detail of this therapy. And last part is conclusion. Before discussing this emergent therapy, let me begin by introducing you some concepts. You may not imagine that the microorganisms in our digestive tract are closely related to our immune system. The intestine is a very long organ. It's about 7 meters from small to the large intestine for adults. And the surface is covered with mucosa. There are countless protruding villas on the mucosa. Each villus has countless microvilli with a total surface area of 300 square kilometers, much larger than the surface area of nerve and skin. These villus help us increasing the efficiency of digestion and absorption of nutrients, but they are exposed to more pathogens relatively. To against the pathogens, about 70% of immune cells have been gathered under the intestinal mucosa, making the intestine become the largest immune organ of the human body. And the intestine is the place where the most microbes gather in the human body, including bacteria, viruses, and mold, protozoan, and parasites. Most of microorganisms are bacteria, including good, intermediate, and pathogenic bacteria, and the amount of percentage is on the slide. The intermediate are usually not so bad, but they will wait for the chance to change for a good or bad, depending on which one takes advantage. Good bacteria such as Lactobacillus acidophilus or Lactobacillus casei. They can break down sugar metabolism to produce lactic or fatty acid, acidify the intestinal environment, to inhibit bacteria, and improve digestion, bowel movement, and enhance our immunity. Bad bacteria such as Staphylococcus aureus and Clostridium difficile. The bacteria are originally live in our intestines, and when their amount is too large, the microflora becomes out of balance. We call gut flora imbalance or dysbiosis. It will cause a series of inflammation and immune disorders. For example, some patients need a long-term antibiotics treatment because of their illness, but the antibiotics will kill the many normal bacteria, which makes the number of difficile relatively increase, causing the fever and diarrhea. In severe cases, it may cause serious diarrhea, and it has a chance of death. The traditional method is to stop antibiotics to relieve the symptoms. However, as the name suggests, sometimes it's useless. Doctors will use other kinds of antibiotics for treatment, but it is extremely prone to relapse, and each relapse will be worse seriously. So some doctors use the fecal microbiota transplant therapy. The cure rate is greatly increased, and the recurrence rate is lower than the traditional therapy. The detail of this therapy will be introduced by my partner Brian.
Fecal microbial transplant, or FMT, is predominantly used for the treatment of Clostridium difficile. As for the fresh stool, it's used to increase viability of bacteria within the stool land. Samples are prepared within 2 to 6 to 8 hours. The sample is then diluted with 2 to 5 times. Fecal microbiota transplantation is the transfer of fecal material from a healthy individual to another person with the aim of treating a disease. It can be described as the ultimate probiotic, as it donates a much greater number and diversity of bacterial strains than any available probiotic. About the administration, the capsule can be delivered by nose, mouth, or by colonoscopy. About the side effect and risk, the patient might have diarrhea or bloating after surgery. These side effects are common and safe. However, persistence of these symptoms beyond a few days may be dangerous or indicate other serious complications, and the risk is intentional perforation and transferring a parasite or pathogen. These problems are usually came from donor, so we have to choose a healthy donor. Now, here comes the problem. How to find a donor? We might thought of our relative is the easiest way, but it can be difficult because the patient and their relative usually have similar bacteria, so the stool bank comes out. Volunteers were screened for eligibility assessment as fecal donors. Candidates received an individual to voluntary participation and underwent a self-assessment that addressed for 4 issues. Presence of a no disease, body overweight, recurrent digestive complaint, and logistical unavailability for stool donation. And they will also have several evaluations to confirm the donor is healthy to donate. But it is not easy as we thought to get the money for the stool bank. For the first time, only 15 people from 10,000 people were selected as suitable stool donors in Hong Kong in 2017. To summarize, we have talked about the brief introduction of human guts and the good and bad microbes in human guts. Then we talk about the fecal microbiota transplant, and the last is about stool bank. The last part of our presentation is the Q&A part. Question number 1. How many ways could capsules deliver to gut? Capsules can be delivered through nose, mouth, and by colonoscopy. Question number 2. Please give some symptoms about gut flora imbalance. Have 2 symptoms: a serious inflammation and immune disorder. Question number 3. Would you like to be treated with this therapy if you have problems about gut? And this is the end of our presentation. Thanks for listening.